Now we're going to talk about bones and anatomical landmarks. While we're labeling these, we're also going to label muscles that attach to them, both origin and insertion. So if a muscle originates, you write O and then the muscle. If it inserts, you write I and then the muscle. So let's get to work. So we're going to start today with the anterior surface of the scapula. The way you can tell the anterior versus posterior surface, the anterior surface has no spine of the scapula. So the first bony landmark we're going to go over is on the very lateral side. It's the point of the shoulder. This is the bone that articulates with the clavicle to make the AC joint, or acromioclavicular joint. This is the acromion process. Now, there are two muscles that attach to the acromion process. One of them originates and one inserts, and this is the perfect time to practice your O colon I colon. We'll start with the muscle that originates. This muscle is responsible for abduction of the shoulder. It also joins with two other portions of this muscle. This muscle is the middle of the three. It is the middle deltoid. So that muscle originates on the acromion process. The muscle that inserts is the most superficial muscle of the back. It's responsible, these fibers, for elevating the scapula. This muscle can also retract the scapula and depress the scapula. It also attaches to the clavicle on the anterior side of the body. So this muscle is the trapezius. So middle deltoid originates, trapezius inserts onto the acromion process. The next structure we have resembles a crow's beak, and that's where it gets its name, resembling a crow's beak. It is located just to the left of the acromion process on this picture, resembling a crow's beak. This is called the coracoid process. There are three muscles that attach to the coracoid process, and this is really important. You need to know these three muscles. Two of them originate and one inserts. The first one that originates is actually named after the coracoid process. This muscle is the coracobrachialis. Coracobrachialis originates on the coracoid process. The second muscle that originates on the coracoid process is responsible for flexion of the shoulder, flexion of the elbow, and supination of the forearm. It has two heads. It is the short head of the biceps brachii. Remember that, short head, not long head, short head. The third muscle inserts onto the coracoid process. This muscle is responsible for protraction or abduction of the scapula. It originates on ribs 3, 4, and 5, so it's on the anterior surface of the body. And when it contracts, it pulls the scapula in. And this is one of the muscles that can cause a condition like thoracic outlet syndrome. This muscle is pectoralis minor. So the three muscles that attach to the coracoid process: coracobrachialis, short head of the biceps brachii, and pectoralis minor. Okay, the next structure we have is to the left of the coracoid process. It's kind of like a curve at the top of the bone. You also have one at the bottom. So because you have two, and one's at the top and one's at the bottom, this is going to be called the superior angle of the scapula. Superior angle. We have one muscle that inserts onto the superior angle of the scapula, and it's named after its function. The action of this muscle is to elevate the scapula. It also originates on the transverse processes of C1 through C4. This muscle is levator scapulae. So because we have a superior angle, we also have to have something that's opposite of that. We wouldn't use directional terms in the name of something if there wasn't something else in the body to distinguish it from. So if we have a superior angle, we also have to have an inferior angle right at the bottom of the scapula. We've got one muscle that originates on the inferior angle of the scapula. This muscle is a muscle that many people often confuse with a rotator cuff muscle. They have pretty much the same name, just a couple letters off. This muscle is also the synergist to the latissimus dorsi. They both do the same thing. This muscle is the teres major. Teres major originates on the inferior angle of the scapula. Okay, next we're going to talk about a couple borders. We have two borders, one on each side of the scapula. We're going to start with the one on the same side as the acromion process. Which side of the scapula is that on? Is it on the inside or the outside? That tells you the name. This is on the outside. So this is the lateral border of the scapula. Now we have one muscle that originates on the lateral border of the scapula. This is a rotator cuff muscle. In fact, it is the only rotator cuff muscle that does not originate in a fossa. This muscle inserts onto the greater tubercle of the humerus. It's responsible for lateral rotation and extension of the shoulder. It is innervated by the axillary nerve, and its name is pretty similar to the muscle we just talked about. This muscle is teres minor. Teres minor originates on the lateral border of the scapula. Now if we have a lateral border, again like the superior angle, we have an inferior angle. If we have a lateral border, we have to have a medial border right on the other side. Another name for the medial border of the scapula is the vertebral border of the scapula because it's located next to the vertebrae. So the medial border of the scapula. And we've got a couple muscles that insert onto the medial border of the scapula. They are direct antagonists to one another. One retracts the scapula and one protracts the scapula. So the muscles that retract the scapula or bring it back are the rhomboids. The muscle that brings it forward originates on ribs 1 through 8 or 9, and it looks like a knife, steak knife if you will, serratus anterior, a serrated knife. And those are direct antagonists to one another. They pull the scapula in opposite directions. Okay, the next structure we have is actually a fossa. It's what you find, basically the entire anterior surface of the scapula is this fossa. This is where one of the rotator cuff muscles originates. This fossa is located quote-unquote under the scapula. So this would be the subscapular fossa. Subscapular fossa is on the anterior surface of the scapula. And we've got one muscle that originates on the subscapular fossa. Its name is really similar to that. This is one of the rotator cuff muscles. It is the only one that does not insert onto the greater tubercle of the humerus. The muscle that originates on the subscapular fossa is subscapularis. Okay, so we're going to talk about another fossa now. The next fossa is actually, can also be called a cavity. It's the socket that helps make the shoulder joint, or the glenohumeral joint. Starts with gleno. The name of this fossa is the glenoid fossa. The glenoid fossa is what the head of the humerus fits into to make the glenohumeral joint, or the shoulder joint. So right below the glenoid fossa we have a little bony projection that sticks out. This bony projection is called a tubercle, and it's named after where it's located in relation to the glenoid fossa. If it's below the glenoid fossa, that would make it the infraglenoid tubercle. Infra, below the glenoid. Okay, we have one muscle that originates here. This muscle is responsible for extension of the shoulder and extension of the elbow. This muscle has 3 heads, and this is the only head of that muscle that you will ever need to know. The muscle that originates on the infraglenoid tubercle is the long head of the triceps brachii. So that is the anterior surface of the scapula. A lot of these we'll be talking about again when we move on to the posterior surface. There are a few structures on the posterior surface of the scapula that you can't see on the anterior surface that we will also be going over. Okay, now we're on the posterior surface of the scapula. So again, we are going to go over all of the bony landmarks and the muscles that attach to them. The main way you can tell that this is the posterior surface is you can see the spine. So we're going to start over on the lateral side again. Again, the big thing that sticks out, the point of the shoulder that articulates with the clavicle, is the acromion process. And the 2 muscles, again, that attach to the acromion process. We have one that has 3 parts to it. It's not the triceps. An anterior, middle, and posterior part. All 3 of these parts insert onto the deltoid tuberosity on the humerus. So the first muscle that originates on the acromion process is the middle deltoid. The muscle that inserts onto the acromion process elevates the scapula, raises it up like you're shrugging your shoulders. This muscle can also retract or adduct the scapula, brings it back towards your vertebrae, and it can also depress or pull your scapula down. The muscle that inserts onto the acromion process is the trapezius. Okay, so we're going to move all the way to the most superior portion of the scapula, all the way on the medial side. Again, it's kind of a sharp curve in that bone. You have 2 of them, one's at the top and one's at the bottom. So because this one is higher than the other, this structure is known as the superior angle of the scapula. So the muscle that inserts here is named after its action. Its action is elevation of the scapula. It raises it up like you're shrugging your shoulders. It's not trapezius. Again, it's named after its action. It originates on the transverse processes of C1 through C4. The muscle that inserts onto the superior angle is levator scapulae. Levator scapulae inserts onto the superior angle of the scapula. So because we have a superior angle, we have to have an inferior angle. So the inferior angle is going to be the very bottom point of the scapula, all the way on the inferior end. We have one muscle that originates on the inferior angle on the posterior side, so on this side of the scapula. This muscle sounds like a rotator cuff muscle. It is the synergist to latissimus dorsi. It extends the shoulder, medially rotates the shoulder, and adducts the shoulder. The muscle that originates on the inferior angle is teres major. Teres major originates on the inferior angle. Okay, so we're going to move up to the structure just below the acromion process. That is a little tiny piece of a bone that sticks out. It's named after its location in relation to the glenoid fossa, which is just above it. So if the glenoid fossa is just above it, this is just below it, and the term for below is infra. This is the infraglenoid tubercle. And we have one muscle that originates there. This muscle extends the shoulder, extends the elbow. It's innervated by the radial nerve. This muscle has 3 heads. And again, this is the only head that you will ever need to know for this muscle. The muscle that originates there is the long head of the triceps brachii. Okay, so now we're going to talk about the borders before we move on to everything that we haven't covered already. So just below the infraglenoid tubercle is a border. It's going to be named after which side of the scapula it is on. Is it on the inside or the outside? The one just below the infraglenoid tubercle is the lateral border. It is on the outside of the scapula. Another name for the lateral border of the scapula is the axillary border of the scapula. It's named after the region of the body, the axilla, that it's next to. We have one muscle that originates on the lateral border of the scapula. It is one of the rotator cuff muscles. It's the only one that does not originate in a fossa. This muscle is similar to one we've already named. It is teres minor. Teres minor originates on the lateral border of the scapula. Okay, so again, with our opposites, if we use a directional term like lateral in the name of something, we have to have something in the body that opposes it. So, if we have a lateral border, it's safe to assume that on the other side of the scapula, we're going to have a medial border. And we have 2 muscles that insert onto the medial border of the scapula, and they are direct antagonists to one another. They move in the exact opposite direction. One retracts or adducts the scapula, and they originate on the spinous processes of C7 through T5. It is the rhomboids. The next muscle protracts the scapula or abducts the scapula, takes it in the opposite direction, originates on ribs 1 through 8 or 9. Looks like a knife. It is serratus anterior. They are direct antagonists to one another. Alright, so the next structure, we're going to start with the structures that we can't see on the posterior side. The main one is what the acromion process actually kind of forms off of. And it's easily palpated if you are working on a client. It is the spine of the scapula. The spine of the scapula actually has muscles that attach to it as well. One that originates and one that inserts. The muscle that originates on the spine of the scapula has 3 parts, an anterior, middle, and posterior part. This is the posterior section. The entire muscle is responsible for flexion of the shoulder, abduction of the shoulder, and extension of the shoulder. This specific part extends the shoulder. That muscle that originates on the spine of the scapula is the posterior deltoid. The muscle that inserts, again, can elevate the scapula, retract or adduct the scapula, and depress the scapula. It also inserts on the acromion process. It is the trapezius. So the muscle that originates, posterior deltoid. The muscle that inserts is trapezius. So now we have a couple fossas, or shallow depressions in bones that have something to do with the spine of the scapula. They're named after their location in relation to the spine of the scapula. The fossa just above the spine of the scapula, think of what term means above, is the supraspinous fossa. Supra means above. So the fossa above the spine of the scapula is the supraspinous fossa. There is one muscle that originates in the supraspinous fossa, and it's really similar to that name. It is one of the rotator cuff muscles. This muscle is responsible for abduction of the shoulder. Muscle that originates in the supraspinous fossa is supraspinatus. Supraspinatus originates in the supraspinous fossa. Okay, so we have another fossa below the spine of the scapula. This is a pretty big fossa. It's a pretty big muscle. So because this muscle is below the spine of the scapula, this fossa is below the spine of the scapula, is called the infraspinous fossa. Infra means below, so it's below the spine. And we've got one muscle that originates in the infraspinous fossa. It is the last rotator cuff muscle, the one that we haven't mentioned yet. Again, names match up. The muscle that originates in the infraspinous fossa is infraspinatus. So the rotator cuff muscles, the easy way to remember is SITS, sits. That tells you, that gives you a hint. It tells you the beginning letter of each rotator cuff muscles. Supraspinatus, infraspinatus, teres minor, and subscapularis. So those are all of the structures on the posterior surface of the scapula. Okay, now we're moving on to the humerus. We're going to start up at the proximal end of the humerus with the structure that articulates with the glenoid fossa to help make the glenohumeral joint. A lot of long bones that we're going to talk about have these structures. This part of the humerus is called the head of the humerus. Head of the humerus fits into the glenoid fossa of the scapula to make the glenohumeral joint, or the shoulder joint. Okay, just lateral to that, we have a big bony thing sticking off there. We have two of them. The other one is just medial to that. This one is larger than the other one. So it's going to start with a term that means bigger. So this is the greater tubercle. Greater tubercle on the lateral portion of the humerus. So we've got three muscles that insert onto the greater tubercle. These three muscles are all rotator cuff muscles. In fact, these three muscles are the beginning three muscles of SITS. So what three muscles start with S, I, and T? Think of your rotator cuff muscles, the muscles we just talked about. The first muscle, it starts with an S, is supraspinatus. The muscle that starts with an I is infraspinatus. And the muscle that starts with a T is teres minor. All three of these muscles insert onto the greater tubercle of the humerus. So that's pretty easy. Three of the four rotator cuff muscles insert onto the same place. Okay, so if we have a greater tubercle, we have to have something that opposes it, right? So just medial to that is going to be the lesser tubercle. The lesser tubercle has one muscle that inserts onto it. This is the fourth rotator cuff muscle. It's the one muscle of the rotator cuff that we haven't talked about the insertion for. This muscle originates on the anterior surface of the scapula in the subscapular fossa. This muscle is the subscapularis. So three of the rotator cuff muscles originate on the greater tubercle, or insert on the greater tubercle. One inserts onto the lesser tubercle. Okay, the next structure we have is actually a groove. It's named after what it's between and the muscle that actually passes through it. So just looking at it, I can see it's between the tubercles. If you know your medical terms, you know that inter means between. It is the intertubercular groove. Another name for the intertubercular groove, again, it's named after the tendon of a specific muscle that passes through it. This muscle originates on the supraglenoid tubercle, which we didn't talk about. This muscle has two heads, and it inserts onto the radial tuberosity of the, radius. So the second name for this groove is the bicipital groove. Okay, so just remember, it can have two different names, intertubercular or bicipital groove. Nothing attaches into that groove. You have one muscle that runs through the groove, but nothing actually attaches inside of it. You have a couple muscles that attach to either side. The pectoralis major attaches to the lateral side of the intertubercular groove. The latissimus dorsi and teres major insert onto the medial side, just below the lesser tubercle. But no muscle attaches inside that groove. Just a passageway for the tendon of the long head of the biceps to pass through. Okay, the next one we have, it's pretty simple. It's named after the muscles that insert there. It is called the deltoid tuberosity. I wish everything were named that easily, huh? Deltoid tuberosity, where the deltoids insert. So anterior deltoid, middle deltoid, and posterior deltoid. All three of those insert onto the deltoid tuberosity. Okay, we're going to move all the way down to the most distal end of the humerus. And we're going to do the lateral side. Now these two structures down here are called the condyles. But they have specific names. No other condyle in the body has a specific name that I can think of. So the one on the lateral side articulates with the head of the radius. It is called the capitulum. Now my easy way to remember what articulates with the head of the radius, when it's cold outside, what do you put on your head? Some people might say a hat. Another word for a hat is a cap. So you put your cap on your head. So the capitulum articulates with the head of the radius. Okay, just next to that we have another condyle, and this again has a specific name. It starts with a T, and it sounds it's also spelled pretty similarly to the big part of the femur that kind of sticks out on the lateral side. It starts with a T. This condyle is called the trochlea. The trochlea. The coronoid process of the ulna wraps around the trochlea, and that's what makes the elbow joint. The coronoid process wraps around the trochlea to make the elbow joint. Okay, so because the capitulum and the trochlea are condyles, what do you think are above the condyles? Think of your medical terms here. A structure above a condyle is called an epicondyle. So the first epicondyle we have is called the lateral epicondyle. And there are a couple things we need to know about the lateral epicondyle. There's one specific muscle group that originates on the lateral epicondyle. This muscle group is the muscle group you find on the posterior surface of the forearm. This muscle group is responsible for extension of the wrist. This muscle group is the extensors of the wrist. The extensors of the wrist originate on the lateral epicondyle. The medical condition you have there, that you should also write down, causes you to feel pain at the lateral epicondyle. And it's named after a sport. It's a sport that causes a lot of stress on the extensors of the wrist. This sport is tennis elbow. So tennis elbow takes place at the lateral epicondyle. That is really important. I can almost guarantee you're going to be asked that on a test. It's a very common question. Okay, so if we have a lateral epicondyle, again, remember our opposites. On the other side, we have a medial epicondyle. And there are a couple of other things you need to know about the medial epicondyle, just like the lateral epicondyle. We need to know a muscle group that originates there, and a medical condition that causes you to feel pain there. Another type of tendinitis, like tennis elbow. So the muscle group that originates on the medial epicondyle is located on the anterior surface of your forearm. This muscle group is responsible for flexion of the wrist. The muscle group that originates at the medial epicondyle of the humerus are the flexors of the wrist. The medical condition, the type of tendinitis that causes you to feel pain at the medial epicondyle, is also named after a sport. Both tennis elbow and this condition are repetitive strain injuries. So it's the same action too many times, it causes this form of tendinitis. This type of tendinitis is called golfer's elbow. Golfer's elbow is felt at the medial epicondyle. Tennis elbow is felt at the lateral epicondyle, so make sure you know those. Okay, the next structures we have are fossas. The first one we're going to do is over on the lateral side. It's named after the structure that goes into it when the elbow is flexed. It's the same structure that articulates with the capitulum. This is called the radial fossa. The head of the radius goes into the radial fossa when the elbow is flexed. If you didn't have a fossa or a small depression in that bone, then you wouldn't be able to flex your elbow as much. Right next to that we have another fossa. This is named after the structure that goes into it when the elbow is flexed. It's part of the ulna, the same part of the ulna that wraps around the trochlea to make the elbow joint. This is the coronoid fossa. The coronoid fossa is named as such because it resembles a crown, or the point of a crown. That's what the term coronoid means. So the coronoid process, which you'll see when we go over the ulna, it kind of sticks up, and if you didn't have that fossa there, it would kind of jab into the humerus, and it would restrict your range of motion at that joint. So that is the humerus. Okay, next we have the radius. The radius is always located on the lateral side of the forearm. It's on the same side as the thumb. Okay, so the very top of the radius articulates with the capitulum of the humerus. So what is the capitulum on top of? The capitulum is on top of the head. Remember, put a cap on the head. Capitulum articulates with the head of the radius. Okay, the next structure we have is kind of a big bony projection that sticks off of the radius. It is a tuberosity, and it's actually named after that bone, which makes that name pretty simple. This is the radial tuberosity. We have one muscle that you need to know that inserts onto the radial tuberosity. This muscle is responsible for flexion of the elbow, flexion of the shoulder, and supination of the forearm. This muscle is the prime mover of supination of the forearm. So to really feel that muscle, put your elbow into flexion and then supinate your forearm. See which muscle contracts. It's a muscle on the anterior surface of your arm. You could probably even feel it when you do that action. The muscle it inserts there, biceps brachii. So just remember, biceps brachii is the prime mover of supination. Okay, moving down to the very distal end of the radius, we have a structure that has a really sharp point. And a really sharp point makes me think of something that looks like a pen, or one of those things you use on a cell phone, a stylus, if you will. This is called a styloid process. Styloid process. So a couple things you need to know. There's one muscle that inserts onto the styloid process of the radius. This muscle originates on the lateral supracondylar ridge of the humerus. I call it the Popeye muscle. That's the muscle that Popeye has that kind of sticks out quite a bit. Actually has the word radial in the name. This is the brachioradialis. You also have a specific medical condition that involves the styloid process. It's caused by trying to brace yourself when you're falling. You got too much pressure placed at that joint, which causes that bone, that structure, the styloid process, to break. It is called a callus fracture. And you often see those types of injuries in people that skateboard and snowboard, and things like that. So that is the radius. Okay, moving on to the ulna. We're going to start with the structure that's kind of on the posterior side. I tilted the ulna a little bit so you can see it. That is the point of your elbow. So if you were to flex your elbow, that's the part that sticks out quite a bit. This part goes into a fossa on the humerus, on the posterior side of the humerus, whose names match up. It starts with an O. This is the olecranon process. A lot of people maybe can't pronounce olecranon process, I've found. It's exactly how it's spelled. Olecranon. We have one muscle that inserts onto the olecranon process. This muscle is responsible for extension of the shoulder and extension of the elbow. It's the muscle that primarily extends the elbow. It's an antagonist to the brachialis. This muscle is the triceps brachii. It extends the elbow, straightens the elbow. Okay, the next structure we have is just below that. It's on the anterior side. This is the process that wraps around the trochlea of the humerus to make the elbow joint. It sounds like part of your scapula, pretty similar, just a couple letters off. This is the coronoid process. Coronoid, resembling a crown. Just below that, we have a bony projection that sticks out. It matches up with a structure you find on the radius. They actually sit right next to each other. And again, it's pretty simple. It's named after that bone. It's a bony projection. This is the ulnar tuberosity. Ulnar tuberosity, right next to the radial tuberosity. Now we have one muscle that inserts onto both the coronoid process and the ulnar tuberosity. This muscle is the strongest flexor of the elbow. Now, a lot of people think elbow flexion, it has to be biceps brachii, but just remember, we already got the insertion of biceps brachii on the radial tuberosity. This muscle is just deep to the biceps brachii. When this elbow contracts, it actually pushes the biceps up. This muscle is brachialis. So brachialis inserts onto both the coronoid process and the ulnar tuberosity. So it's not a very long muscle, but it's a very powerful muscle. Okay, we're going to go down to the distal end, not the very end, just above that. The ulna is kind of upside down. So where on the radius, the very top part, is the head is down at the distal end on the ulna. Just next to that, you have another sharp point, just like you have on the radius. It looks like the point on a pen or a stylus. That makes that the styloid process of the ulna. So I have a simple way, maybe simple for me. I actually think it's pretty dumb, but it works for me. Easy way to remember where the styloid processes are. When you're wearing a watch, your wrist is styling. That's what I say. I know you just chuckled because it's hilarious. So again, my easy way to remember where the styloid processes are. When you're wearing a watch, your wrist is styling. And that is the ulna. Okay, moving on to the pelvis. Now, a lot of people might be intimidated by the pelvis. It's got kind of a weird shape. But if you just remember that the pelvis is broken up into 3 separate bones that have just fused together, it makes it a lot simpler. You can kind of break it down into those 3 separate bones. Remember, the bony landmarks for those 3 separate bones, the ilium, ischium, and the pubis, and makes it a lot more likely that you will actually remember them instead of thinking this, big, huge thing that has all these parts and it just looks crazy and it's just kind of all over the place. So we're going to start with the ilium, and we're going to start over on the left side of this picture, up at the very top of the ilium. Right up here we have a ridge or a shelf, and that's what most people think of as the hips. When you're palpating that area, that's where you kind of figure out where the pelvis is. So this structure is called, another word for a ridge or a shelf is called a crest. And most of these bony landmarks are named after the bone that they're a part of. This is the iliac crest. Now we have 2 muscles that attach that. One originates and one inserts. And we'll start with the muscle that originates. The muscle that originates here also originates in the lumbar aponeurosis. It inserts onto the medial lip of the intertubercular or bicipital groove. It's responsible for extension, adduction, and medial rotation of the shoulder. Think of pull-ups and what muscle you're working when you're doing that exercise. The muscle that originates there is latissimus dorsi. The muscle that inserts onto the iliac crest has 4 sides, and it's in the lumbar region. It's named after those 2 things. The muscle that inserts onto the iliac crest is quadratus lumborum. 4 sides in the lumbar region. So latissimus dorsi originates on the iliac crest. Quadratus lumborum inserts onto the iliac crest, and that's what causes your hips to elevate, like you see in belly dancers or hula dancers. Okay, we're going to go over onto the right side. We're still on the ilium. Next, we've got a fossa. That's part of the ilium. It's actually, a pretty simple name referring to the ilium. It's the iliac fossa. So we've got one muscle that originates on the iliac fossa. This muscle joins with the psoas major to make the iliopsoas muscle. This muscle inserts onto the lesser trochanter of the femur. The muscle that originates on the iliac fossa is the iliacus. Just remember, iliacus, iliac fossa. It's got the name iliac in it. Pretty simple. Okay, we're going to go back to the left-hand side. So the next structure below the iliac crest is the point of your hip. And you have 4 of these specific structures. They all have directional terms in their name. This one is on the front of the body. You also have a couple on the back, so it has to start with the word anterior. You also have 2 on the anterior side of the body. This one is above the one just below it, so I'd make it superior. So it is the anterior superior iliac spine, or ASIS, as is. You can hear it pronounced a couple different ways. ASIS, anterior superior iliac spine. We have one muscle that originates on the anterior superior iliac spine. It is the longest muscle in the body and inserts onto the pes anserinus on the tibia. The longest muscle in the body is sartorius. Okay, so just below the anterior superior iliac spine, again, think of our directional terms. If we have an anterior superior, we have to have an anterior inferior iliac spine. So just below that, the anterior inferior iliac spine. We have one muscle that originates on the anterior inferior iliac spine. This muscle is one of the quadricep muscles. It's on the anterior surface of the body. It is the only quadricep muscle that crosses 2 joints. It crosses the hip and crosses the knee. This muscle flexes the hip and extends the knee. Helps keep us erect or upright. This muscle is rectus femoris. Alright, now we're going to move over onto a couple structures on the pubis. So we're done with the ilium. The next structure, which is just to the inside of the anterior inferior iliac spine, is called a ramus. And a ramus is an elongated piece of a bone. You also have a ramus on your mandible. We have 2 ramuses, or rami, on the pubis. This one is above the other ones. That makes this the superior ramus of the pubis. The superior ramus of the pubis, again, we have 2 of them. One's above the other one. This is the superior. We have one muscle that originates on the superior ramus of the pubis. It is a muscle in the adductor muscle group. So remember, it's on the medial portion of the thigh, just like this structure. And that's where this muscle originates. It is one of the adductor muscles. It's one of the 2 adductor muscles that don't actually start with the word adductor. The insertion of this structure is on the posterior side of the femur, and it's actually named after this muscle. The insertion is the pectineal line. The muscle that originates here is the pectineus. Kind of sounds like a muscle in your chest. Pectineus originates on the superior ramus of the pubis. Okay, so we're going to move to the right of that. We have a disc of cartilage that holds the pubic bones together. Remember the medical term sym means together. That is the pubic symphysis. The pubic symphysis is a gliding joint. It can move in any direction. It's a disc of cartilage. So remember, a disc of cartilage, like the kind you find in your vertebrae, or your acromioclavicular, or sternoclavicular, or pubic symphysis. Those are all gliding joints. They can move in any direction. So the pubic symphysis holds the 2 pubic bones together, and that's what helps really create that girdle. So the next structure we have above that is pretty similar to the structure we have on the ilium. It's like a shelf or a ridge, just kind of sits there. It's called the pubic crest. So if you were to palpate your pubic bones, you can definitely feel that. You find your pubic symphysis, just go to the sides there. Okay, the next structure we have is the other ramus, and it's just below the pubic crest. The line just below it. Again, we have a superior ramus, so we also have to have an inferior ramus. There are two muscles that originate on the inferior ramus of the pubis. They are both adductor muscles. One is an adductor muscle. It starts with the word adductor, and it's named after its size. It's a very big muscle. Think a really big handgun. What are those called? Those are called magnums. The adductor muscle that originates on the inferior ramus of the pubis is adductor magnus. The second muscle that originates on the inferior ramus of the pubis is another adductor muscle, but it's the second one that doesn't start with the word adductor. It starts with a G, and it inserts onto the pes anserinus on the tibia. This muscle is gracilis. So the two muscles that originate on the inferior ramus of the pubis, gracilis and adductor magnus. Okay, the next structure we have is actually on the ischium. It is the most inferior portion of the pelvis. It's the bone that you sit on. It's kind of a bony projection that comes off of the ischium. It is the ischial tuberosity. Ischial tuberosity. We have four muscles that originate on the ischial tuberosity. You're only going to write down three. Three muscles that originate on the ischial tuberosity are the hamstring muscles. Whenever you write down or label the hamstring muscles, always do it in this order, the order from medial to lateral. The most medial hamstring muscle is semimembranosus. Match up membranosus with medial. The second one is semitendinosus, and then the most lateral is biceps femoris. Semimembranosus, semitendinosus, biceps femoris. Okay, the next structure we have is all the way on the right side. It's a socket that helps to make the hip joint. It's what the head of the femur goes into. It starts with an A. Sounds like a potty mouth word. The name of that joint is the iliofemoral joint. Another name for it is the coxal joint. One half of the pelvis is called a coxae, C-O-X-A-E. So this helps to make a coxal or iliofemoral joint. So again, kind of sounds like a potty mouth word, bad word. That structure, that socket, is called the acetabulum. Acetabulum. And again, the part of the femur that goes into the acetabulum is the head. Okay, the last structure we have is actually a hole over on the left side of the picture. A hole in a bone is called a foramen. So this is a foramen, and the easy way for me to remember is the hole makes the shape of the first letter. It is called the obturator foramen. So I'm pretty sure that's the largest foramen in the body. The name of the nerve that goes through the obturator foramen is the obturator nerve, so it's a pretty easy way to remember which nerve that is. And that nerve innervates the adductor, so it's on the medial portion of the thigh. And that is the pelvis. Okay, moving on to the femur. We're going to start first with the structure, the most proximal structure of the femur. This structure goes into the acetabulum on the pelvis to make the iliofemoral or coxal joint. This structure is the head of the femur. Head of the femur goes into the acetabulum to make the iliofemoral or coxal joint. Okay, the next structure we have is over on the lateral side. It's the big structure that kind of sticks out. If you land on that, if you fall on that, it hurts really bad. We have one that's also on the medial side. This one is bigger. It is called the greater trochanter. Greater trochanter. Now we have one muscle that inserts onto the greater trochanter of the femur. This muscle laterally rotates or externally rotates and abducts the hip. This is also the muscle that's primarily responsible for sciatica. This muscle is the piriformis. Piriformis inserts onto the greater trochanter. Okay, so if we have a greater trochanter on the lateral side, on the medial side, we have to have the opposite of that. So the opposite of greater would be lesser. Just below the head of the femur, we have the lesser trochanter. And we have two muscles that insert onto the lesser trochanter of the femur. One of these muscles originates on the iliac fossa, which we just went over a couple minutes ago. This muscle joins with the other muscle that inserts onto the lesser trochanter, which originates on the anterior surface of the lumbar vertebrae. When this muscle is tight, it can result in lordosis. So the two muscles that insert onto the lesser trochanter, iliacus and psoas major. Those muscles together make the iliopsoas muscle. Okay, so we're going to move down to the distal end. So the next structure down from the lesser trochanter is actually a tubercle. And it's named after the muscle that inserts there. So think about the muscle group that's located on the medial portion of the thigh. It's named after a specific muscle of that group. This is the adductor tubercle. The adductors are on the medial portion of the thigh. So there's one muscle that inserts onto the adductor tubercle. And wouldn't you know it, it's one of the adductor muscles. It is the one that's named after its size, not its length, but its size and how big it is. Muscle that inserts onto the adductor tubercle is adductor magnus. Adductor magnus inserts onto the adductor tubercle. Okay, just below that, the most inferior or the most distal portion of the femur, which you can't see, they're mostly seen on the posterior side. They're called condyles. But above the condyles, think of your medical term for above the condyles we have epicondyles. On the medial side, we have the medial epicondyle. Medial epicondyle on the medial side of the femur. And if we have a medial epicondyle, of course, on the other side, the opposite of medial is going to be lateral. So we also have a lateral epicondyle on the other side. There is one muscle that originates on both the medial and lateral epicondyles. And it's only on the posterior side, but you're going to want to write it down here just so you kind of identify that. This muscle crosses two joints. It crosses the knee and the ankle. Again, on the posterior side of the body. This muscle flexes the knee and plantar flexes the ankle. It joins with the soleus connects to the ankle via the calcaneal or Achilles tendon. The muscle that originates on both the lateral epicondyle and medial epicondyles on the posterior side of the femur is gastrocnemius. Gastrocnemius originates on both the lateral epicondyle and medial epicondyle on the posterior surface of the femur. And that is the femur. Okay, now we're on the tibia. So the very top part of the tibia is the part that the meniscus rests on top of. The meniscus is a cartilage inside the knee that helps to cushion and protect that joint. It's really thick. So think of geology and a flat top mountain. A flat top mountain is called a plateau. This is the tibial plateau. Very top part that articulates with the femur. Okay, just below the tibial plateau, we have what are called condyles. The condyles of the tibia articulate with the same condyles you find on the femur. So on the medial side of the tibia, we have the medial condyle. And the medial condyle articulates with the medial condyle of the femur. There are no epicondyles on the tibia, only condyles. So again, our opposites. If we have a medial condyle on the medial side, we have to have a lateral condyle on the lateral side. The lateral condyle articulates with the lateral condyle on the femur. And these are flat surfaces, and that's what allows the knee to move pretty easily, flex and extend pretty easily. Okay, right on the anterior portion of the tibia, up near the top, we have a bony projection that sticks out. It's named after the bone that it's a part of. This is called the tibial tuberosity. This is where a medical condition like Osgood-Schlatter disease could happen. We also have one specific muscle group that inserts onto the tibial tuberosity. This muscle group is responsible for extension of the knee and flexion of the hip. This muscle group also contains a specific tendon that has the patella inside of it, attaches to that tendon. That tendon is called the patellar tendon. This muscle group is innervated by the femoral nerve. And probably the easiest clue I can give about this muscle group, besides where it's located on the anterior surface of the body, on the thigh, is how many heads it has. This muscle has 4 heads. The muscle that inserts onto the tibial tuberosity are the quadriceps, rectus femoris, vastus lateralis, vastus medialis, vastus intermedius. They all join together and attach to the tibial tuberosity. Okay, down at the very distal end, this is what most people think of as the ankle, but it's actually not the ankle. It's that big part of that bone that sticks out. We have 2 of them. One's on the tibia on the medial side, one's on the fibula on the lateral side. This is the medial malleolus. And the malleoli, the one on the tibia and the fibula, are what people think of as the ankles. And they can break, and typically that's what is broken if you have a broken ankle. It's one of the malleoli. Typically it's the lateral malleolus, the one on the fibula. And that is the tibia. Okay, so now we're going to talk about the fibula. The fibula is the last bone we're going to go over. So the fibula is always on the lateral side of the leg. It's a weight-bearing bone. It's a stabilizing bone. It helps to strengthen the leg. So the very top part of the fibula, most people would think it's the head, but it's actually not. It looks like a very sharp point to me, like the point of a pen or the thing you use on a phone. That is a styloid process. So we have a styloid process on our radius, ulna, and our fibula. Okay, so just below the styloid process, we have what most people think the styloid process is up at the very top. That is the head of the fibula. Now we have a few muscles that attach to the head of the fibula. Two of them originate and one inserts. So we'll start with the two that originate. One is actually named after the bone that it originates on. It's not an English word, it's more French than anything. That muscle is one of the stirrup muscles. Helps to evert and plantar flex the foot. This muscle is the peroneus longus. The second muscle that originates on the head of the fibula is located on the posterior surface of the leg. It's directly deep to the gastroc. This muscle plantar flexes the foot, and that's all it does. It looks like a fish that you find in the Mediterranean, and that's what it's named after. This muscle is the soleus. So peroneus longus and soleus originate on the head of the fibula. And we have one muscle that inserts onto the head of the fibula. This muscle is one of the hamstring muscles. It is the most lateral hamstring muscle. So if you remember the order of the hamstrings that we just talked about, you can remember which one's on the lateral side, the same side as the fibula. Semimembranosus is the most medial, and semitendinosus, and the most lateral, the muscle that inserts onto the head of the fibula, is biceps femoris. So peroneus longus and soleus originate on the head of the fibula, biceps femoris inserts. Okay, down at the distal end of the fibula, we have that big part of that bone that kind of sticks out. You have one of these on your tibia as well. It's what most people think of as the ankle joint. This is the lateral malleolus. Lateral malleolus. And this is typically what's broken if you have a broken ankle. So that is the fibula.